Hey everyone, it's Norma, and welcome back to my channel. Today, we're diving into a topic that affects so many of us as we age, acid reflux. You know that burning sensation in your chest, that sour taste in your mouth? Yeah, we're tackling that uncomfortable topic head on. Acid reflux can really put a damper on your golden years, making it tough to enjoy your favorite foods and activities. But the good news is it doesn't have to be a constant battle. With a little knowledge and a few lifestyle adjustments, you can get a handle on acid reflux and start feeling your best again. So, if you're ready to say goodbye to heartburn and hello to happy digestion, stick around. We're going to break down the causes, concerns, and management of acid reflux in seniors so you can start living your life to the fullest. Let's get to it. All right, let's get down to the basics. What exactly causes that fiery feeling in your chest? Well, imagine this. You've just finished a delicious meal and your food is making its way down to your stomach. Between your esophagus, that's the tube that carries food from your mouth to your stomach, and your stomach, there's this little gatekeeper called the lower esophageal sphincter, or LES for short. Now, the LES is like a one-way valve, making sure food goes down and stays down. But as we age, sometimes that valve can get a little, lazy. It might not close as tightly as it used to, allowing stomach acid to sneak back up into the esophagus. And boom, that's when you feel that uncomfortable burning sensation we call heartburn. But it's not just about a weakening less. Sometimes a hiatal hernia can also be the culprit. This happens when the upper part of your stomach bulges through your diaphragm, the muscle that separates your chest from your abdomen. This can disrupt the normal function of the LES, making acid reflux more likely. And let's not forget about our lifestyle choices. You know, those little indulgences we all enjoy from time to time, things like overeating, indulging in fatty or spicy foods, sipping on coffee or alcohol, even smoking. These can all contribute to acid reflux. And then there are certain medications, some painkillers, muscle relaxants, and even medications for high blood pressure that can relax the LES, making it easier for acid to creep back up. Now, I know what you might be thinking. Norma, you're making me paranoid about everything, but don't worry, I'm not here to scare you off your morning coffee or that delicious plate of pasta. The key is to be aware of these potential triggers and how your body reacts to them. Keeping a food diary can be super helpful in identifying what foods and drinks might be setting off your symptoms. Remember, knowledge is power. By understanding what causes acid reflux, you can start making informed choices to minimize those uncomfortable flare-ups. Okay, so we've talked about what causes acid reflux, but why all the fuss? Is it really that big of a deal? Well, while occasional heartburn might not seem like a major health concern, frequent or persistent acid reflux can actually lead to some serious complications, especially as we get older. You see, that constant backwash of stomach acid can irritate the lining of your esophagus, leading to a condition called esophagitis. Now, esophagitis can cause some pretty unpleasant symptoms like painful swallowing, chest pain, and even difficulty swallowing. And if left untreated, repeated bouts of esophagitis can cause the esophagus to narrow, a condition known as a stricture. Strictures can make it difficult for food to pass through the esophagus, leading to choking, vomiting, and weight loss. But that's not all. Long-term acid reflux can also increase your risk of developing Barrett's esophagus, a condition where the lining of the esophagus starts to resemble the lining of the stomach. Now, while Barrett's esophagus itself might not cause any noticeable symptoms, it does significantly increase your risk of developing esophageal cancer. And let's not forget about the impact acid reflux can have on your overall quality of life. That constant discomfort, the sleep disturbances, the limitations on your diet, it can really take a toll on your physical and emotional well-being. Plus, acid reflux can worsen symptoms of other health conditions common in seniors, like COPD, heart disease, and even dementia. So as you can see, acid reflux is more than just a minor inconvenience. It's a serious health concern that deserves our attention. But don't worry, we're not going to leave you hanging. Now that we understand the causes and concerns associated with acid reflux, let's dive into the part you've all been waiting for: how to manage it and get back to enjoying your life. The good news is that there are plenty of things you can do to find relief and prevent those fiery flare-ups. And it all starts with making some simple yet powerful lifestyle changes. First and foremost, let's talk about your diet. Certain foods and drinks are notorious for triggering acid reflux. These include greasy or fatty foods, spicy dishes, citrus fruits and juices, tomatoes, onions, garlic, chocolate, coffee, carbonated beverages, and alcohol. Now, I know it's tough to resist these tasty treats, but try keeping a food diary to identify your personal triggers and see if limiting them makes a difference. Next up, portion control. Overeating can put a lot of pressure on your LES, making it more likely for acid to escape. So try eating smaller, more frequent meals throughout the day instead of 3 large ones. And give yourself time to digest. Avoid lying down or going to bed immediately after eating. Another simple yet effective tip is to elevate your head while you sleep. This helps gravity keep the acid down in your stomach where it belongs. You can do this by using a wedge pillow or adding an extra pillow or 2 under your head. Now let's talk about clothing. Tight-fitting clothes, especially around your waist, can put extra pressure on your stomach, pushing acid upwards. Opt for loose-fitting, comfortable clothing, especially after meals. And don't forget about those sneaky habits. Smoking weakens the LES, making it easier for acid to back up. If you smoke, quitting is one of the best things you can do for your overall health, including your digestive health. If lifestyle changes alone aren't enough to keep your acid reflux in check, don't worry. There are medications that can help. Over-the-counter antacids can provide quick relief by neutralizing stomach acid. H2 blockers like famotidine, Pepcid, and ranitidine, Zantac, reduce the production of stomach acid. And if you need something a bit stronger, proton pump inhibitors or PPIs are the most effective type of medication for treating acid reflux. These medications block acid production and allow time for your esophagus to heal. Remember, it's always best to consult with your healthcare provider before starting any new medications, even over-the-counter ones, to make sure they are safe and appropriate for you. So, there you have it. We've covered the causes, the concerns, and most importantly, the ways to manage acid reflux so you can get back to enjoying those golden years to the fullest. Remember, you don't have to suffer in silence. By taking control of your health, making those lifestyle adjustments, and working closely with your healthcare provider, you can effectively manage acid reflux and prevent those unwanted complications. You deserve to enjoy your favorite foods, sleep soundly through the night, and live your life with energy and vitality. Thanks for joining me today. Don't forget to give this video a thumbs up if you found it helpful, and hit that subscribe button for more tips and advice on living your healthiest life after 50. Until next time, take care and stay well.